Alzheimer's Level 2 course objectives. Understand and name some of the challenging behaviors related to Alzheimer's disease. Identify behavior management strategies and problem-solving approaches. Understand best practices for assisting Alzheimer's residents with their activities of daily living. Understand what activities are appropriate for Alzheimer's residents. Identify causes of stress for caregivers. Identify strategies and techniques for stress management. Detect and prevent dehydration and malnutrition. Identify medications prescribed for people with Alzheimer's. Restraints and alternatives to restraints. Level 2 Pretest. True or false questions. After completing this module, you should be able to answer the following questions. Wandering is not common for residents with dementia. Bathing can sometimes be a battle. Do everything for the resident with dementia. Dehydration can trigger unwanted behaviors. Behavior management. Challenging behaviors associated with dementia. Most common behaviors are sundowning, aggression, agitation, wandering. Sundowning. Behavioral problems that begin at dusk and last into the night. Sundowning is a symptom of dementia. It's also known as late-day confusion. A person's confusion and agitation may get worse in the late afternoon and evening. It is common for people with middle and later stage dementia to experience increased confusion, anxiety, agitation, pacing, and disorientation beginning in the mid to later afternoon and continue into the night. These late-day increased behavior problems are often called sundowning. Sundowning can disrupt the body's sleep-wake cycle, causing more behavioral problems. Sundowning causes restlessness and disorientation, discourage naps early in the day, avoid dietary stimulants, exhaustion, lack of physical activity. Mental and physical exhaustion from a full day trying to keep up with unfamiliar or confusing environment. Caregivers who are exhausted by the events of the day may give off nonverbal clues of frustration, which could lead to negative reactions in persons with dementia. Reduced lighting and increased shadows may cause persons with dementia to misinterpret what they see, subsequently becoming more agitated. Boredom or lack of activity throughout the day. Learn some helpful behaviors and environmental tips to manage sundowning, which can occur in older persons with or without dementia during late afternoon and evening. Being the caregiver for one experiencing sundowning can be stressful and exhausting, and caregivers can become sleep deprived. Behavioral and environmental approaches can be effective in lessening or even preventing some symptoms, and where appropriate should be used as the first line of intervention. Persons with Alzheimer's or dementias are thought to experience sundowning for a variety of reasons, including extreme fatigue, late day lighting, pain, vision problems, hunger or thirst, and depression. These are just a few of the possible causes, and when your loved one is sundowning, determine first what is bothering him or her. This will help you determine how to respond. Environmental approaches. Environmental cues can impact a person's sundowning, adding to their agitation, confusion, or aggressiveness. To set up the immediate environment to lessen the symptoms of sundowning, try the following. During the daytime, keep window coverings open for maximum exposure to bright light. At dusk, close the window coverings and turn lights on to eliminate any shadows caused by the late daylight. Shadows can cause confusion for one with dementia. Create a quiet routine for the early evening. This may include an early evening walk or calming background music. Minimize loud background noises such as a banging pot or sudden loud noises. If needed, create some white noise, the type of noise that is low and in the background. It can help lessen the impact of sudden noises. Minimize clutter in rooms. Minimize the number of people in the room. Monitor TV watching and the images on the screen. Many TV scenes can be upsetting, especially to one with dementia. Behavioral approaches. Structure the day and maintain a stable routine as much as possible. Routine and structure will help your loved one to know what to expect, which is comforting for him or her. This also includes residents in a facility. A stable routine is extremely important. Give simple instructions for meals, bathing, etc. Eliminate caffeine and alcohol, especially late in the day. Include outside physical activity and exercise as part of every day. Keep daytime naps short and earlier rather than later in the day. Responding to sundowning as it happens. Just as you have the tools, but when your resident or loved one is agitated or fixed on something at other times of the day, you have the tools to help them settle down and relax when sundowning. Listen carefully. It can be difficult to identify the source of their fear or agitation, but keep listening and try different things to help them calm down. For instance, they may see someone in the room, but maybe it is the shadow created by the light outside the window. Redirect where possible. Ask questions. Is it almost time for dinner? Go ahead and eat. Does the resident or loved one like to fold the laundry? Find something, even the laundry that is already folded in the closet, for them to do. Pull it out and start all over again. Towels and napkins are also always useful for this activity. If it's after dinner and a good night for a walk, go out. Sometimes a TV or radio program can be a good method to redirect and take their minds off things that are bothering them. Just be careful about the images on the screen. Use gentle touch to connect. Hold their hand, stroke their back, or hug them. Such touching will be soothing and may be just what they need. Aggression. They may be verbal or physical behaviors. They can result from a stressful situation. They can occur suddenly. Aggressive behaviors may be verbal or physical. They can occur suddenly with no apparent reason or result from a frustrating situation. While aggression can be hard to cope with, understanding that the person with Alzheimer's or dementia is not acting this way on purpose can help. Aggression can be caused by many factors including physical discomfort, environmental factors, and poor communication. If the person with Alzheimer's is aggressive, consider what may be contributing to the change in the behavior. Is the person able to let you know he or she is experiencing physical pain? Is it not uncommon for persons with Alzheimer's or dementias to have urinary tract or other infections? Due to their loss of cognitive function, they are unable to articulate or identify the cause of physical discomfort and, therefore, may express it through physical aggression. Is the person tired because of inadequate sleep or rest? Is the person hungry or thirsty? Are medications causing side effects? Side effects are especially likely to occur when individuals are taking multiple medications for several health conditions. Is the person overstimulated by loud noises, an overactive environment, or physical clutter? Large crowds are being surrounded by unfamiliar people, even within one's own home or facility, can be overstimulating for a person with dementia. Does the person feel lost? Most people function better during a certain time of the day. Typically, mornings are best. Consider the time of day when making appointments or scheduling activities. Choose a time when you know the person is most alert and best able to process new information or surroundings. Are your instructions simple and easy to understand? Are you asking too many questions or making too many statements at once? Is the person picking up on your own stress or irritability? Dealing with aggression. Try to identify the immediate cause. Think about what happened right before the reaction that may have triggered the behavior. Rule out pain as a cause of the behavior. Pain can trigger aggressive behavior for a person with dementia. Focus on feelings, not the facts. Rather than focusing on specific details, consider the person's emotions, look for feelings behind the words or actions. Don't get upset. Be positive and reassuring. Speak slowly in a soft tone. Limit distractions. Examine the person's surroundings and adapt them to avoid similar situations. Try a relaxing activity. Use music, massage, or exercise to help soothe the person. Shift the focus to another activity. The immediate situation or activity may have unintentionally caused the aggressive response. Try something different. Take a break. If the person is in a safe environment and you are able to walk away and take a moment for yourself. Ensure safety. Make sure you and the person are safe. If the person is unable to calm down, seek assistance from others. Always call 911 in emergency situations. If you do call 911, make sure you tell the responders the person has dementia, which has been causing them to act aggressively. Share your other experiences with your coworkers, management, or administrator. Agitation. Becoming restless, causing a need to move around or pace, or become upset in certain places, or when focused on specific details. A person with Alzheimer's may feel anxious or agitated. He or she may become restless, causing a need to move around or pace, or become upset in certain places, or when focused on specific details. Anxiety and agitation may be caused by a number of different medical conditions, medication interactions, or by any circumstance that worsens the person's ability to think. Ultimately, the person with dementia is biologically experiencing a profound loss of their ability to negotiate new information and stimulus. It is a direct result of the disease. Situations that may lead to agitation include moving to a new residence or nursing home or assisted living, changes in an environment such as travel, hospitalization, or the presence of house guests, changing caregivers, misperceived threats, fear and fatigue resulting from trying to make sense out of a confusing world. Dealing with agitation. Back off and reassure. Don't raise your voice or argue. Avoid triggers. Encourage a short walk. Create a calm environment. Remove stressors. This may involve moving the person to a safer or quieter place, or offering a security object, rest, or privacy. Try soothing rituals and limiting caffeine use. Avoid environmental triggers. Noise, glare, and background distraction, such as having the television on, can act as a trigger. Monitor personal comfort. Check for pain, hunger, thirst, constipation, full bladder, fatigue, infections, and skin irritation. Make sure the room is at a comfortable temperature. Be sensitive to fear, misperceived threats, and frustration with expression what is wanted. Simplify task and routine. Provide an opportunity for exercise. Go for a walk. Garden together. Put on music and dance. How to respond. Do back off and ask permission. Use calm, positive statements. Reassure. Slow down. Add light. Offer guided choices between two options. Focus on pleasant events. Offer simple exercise options and try to limit stimulation. You can always say, "May I help you? Do you have time to help me? You are safe here. Everything is under control. I apologize." I'm sorry that you're upset. I know it's hard, and I will stay with you till you feel better. Listen to the frustration. Find out what may be causing the agitation and try to understand. Provide reassurance. Use calming phrases such as, "You are safe here," "I'm sorry that you are upset," and "I will stay until you feel better." Let the person know you are there. Involve the person in activities. Try using art, music, or other activities to help engage the person and divert attention away from the anxiety. Modify the environment. Decrease noise and distractions or relocate. Find outlets for the person's energy. The person may be looking for something to do. Take a walk or go for a car ride. Check yourself. Don't raise your voice, show alarm or offense, or corner, crowd, restrain, criticize, ignore, or argue with the person. Take care not to make sudden movements out of the person's view. Wandering. Getting lost or wandering is common for dementia people. This can happen at any stage. They can become easily lost or disoriented. Anyone who has a memory problem or is able to walk is at risk for wandering. Even in the early stages of dementia, a person can become disoriented or confused for a period of time. It is important to plan ahead for this type of situation. Be on the lookout for the following warning signs. Returns from a regular walk or drive later than usual. Forgets how to get to familiar places. Talks about fulfilling former obligations such as going to work. Tries or wants to go home even when at home. Is restless, paces, or makes repetitive movements. Has difficulty locating familiar places like the bathroom, bedroom, or dining room. Asks the whereabouts of past friends and family. Acts as if doing a hobby or chore, but nothing gets done. Example, they move around pots and dirt without actually planting anything. Acts nervous or anxious in crowded areas such as a shopping mall or restaurant. Tips to prevent wandering. Wandering can happen anytime, even if you're the most diligent of caregivers. Use the following strategies to help lower the chances. Carry out daily activities, have a routine, and provide structure. Identify the most likely times of the day that wandering may occur. Plan activities at that time. Activities and exercise can reduce agitation, anxiety, and restlessness. Reassure the person if he or she feels lost, abandoned, or disoriented. If the person with dementia wants to leave to go home or go to work, use communication focused on exploration and validation. Refrain from correcting the person. For example, "We are staying here tonight. We are safe and I'll be with you. We can go home in the morning after a good night's rest." Ensure all basic needs are met. Has the person gone to the bathroom? Are they hungry or thirsty? Avoid busy places that are confusing and causing disorientation. This could be shopping malls, grocery stores, or other busy venues. Place locks out of the line of sight. Install either high or low on exterior doors. And consider placing slide bolts at the top or the bottom. Use devices that signal when a door or window is open. This can be as simple as a bell placed above a door or a sophisticated electronic alarm system. Provide supervision. Do not leave someone with dementia unsupervised in a new or changed environment surroundings. Never lock a person in a home room or leave him alone in a car. Keep car keys out of sight. If the person is no longer driving, remove access to car keys. A person with dementia may not just wander by foot. They may get into a car and drive off. The stress experienced by caregivers when a person with dementia wanders and becomes lost is significant. Have a plan in place beforehand and review your facility's emergency management plan and what to do when someone wanders off. Keep a list of people to call for help. Know your neighborhood. Keep a list of the places where the person may wander. And make sure that you call 911 and follow your facilities, procedures, and protocols immediately. Dealing with wandering. Use monitoring devices, lock the doors, use alarms at exits, alert everyone that the person wanders, label rooms, label objects, maintain a calm environment, redirect movement, keep the person occupied, and you may camouflage exits. Behavior management strategies. Try to anticipate and redirect the behavior. Don't try to control the behavior. Remember, you can't change the person, and don't take the behavior personally. Many people find the changes in behavior caused by Alzheimer's to be the most challenging and distressing effect of the disease. The chief cause of behavioral symptoms is the progressive deterioration of brain cells. However, medication, environmental influences, and some medical conditions also can cause symptoms or make them worse. In the early stage, people may experience behavior and personality changes such as irritability, anxiety, or depression. In later stages, other symptoms may occur, including anger and aggression, anxiety and agitation, general emotional distress, physical or verbal outburst, restlessness, pacing, shredding paper or tissues, hallucinations, delusions, sleep issues, and sundowning. Events or changes in a person's surroundings often play a role in triggering behavioral symptoms. Change can be stressful for anyone and can be especially difficult for a person with Alzheimer's disease. It can increase the fear or fatigue of trying to make sense of an increasingly confusing world. Situations affecting behavior may include moving to a new resident or nursing home or assisted living, changes in familiar environment or caregiver arrangements, being asked to bathe or change clothing. Identifying what has triggered a behavior can often help in selecting the best approach to deal with it. There are also non-drug approaches to managing behavior symptoms to promote physical and emotional comfort. Many of these strategies aim to identify and address needs that the person with Alzheimer's may have difficulty expressing as the disease progresses. Non-drug approaches should always be tried first. Steps to developing successful non-drug treatment include recognizing that the person is not just acting mean or ornery, but is having further symptoms of the disease. Identifying the cause and how the symptom may relate to the experience of the person with Alzheimer's. Changing the environment to resolve challenges and obstacles to comfort, security, and ease of mind. Monitor personal comfort. Check for pain, hunger, thirst, constipation, full bladder, fatigue, infections, or skin irritations. Maintain a comfortable room temperature. Avoid being confrontational or arguing about facts. For example, if a person expresses a wish to go visit a parent who died years ago, don't point out that the parent is dead. Instead say, "Your mother is a wonderful person. I would like to see her too." Redirect the person's attention. Try to remain flexible, patient, and supportive by responding to the emotion, not the behavior. Create a calm environment, avoid noise, glare, insecure space, and too much background distraction, including television. Allow adequate rest between stimulating events. Provide a security object. Acknowledge requests and respond to them. Look for reasons behind each behavior. Explore various solutions, and don't take the behavior personally. If the non-drug approach fails after being applied consistently, introduction medications may be appropriate for individuals with severe symptoms who have the potential harm for themselves or others. While prescription medications can be effective in some situations, they must be used carefully and are most effective when combined with non-drug approaches. When considering use of medications, it's important to understand that no drugs are specifically approved by the FDA to treat behavioral and psychiatric dementia symptoms. Some examples discussed are off-label use medications, and a physician may prescribe a drug for that purpose. Behavior management strategies. Find the trigger and manage the behavior. All behavior has a purpose. All behavior is triggered. Check for changes in doctor's orders, medications, or pain level. Be flexible. Try different approaches. Behavior management. Alzheimer's residents may have challenging behaviors. Some behavior triggers may be pain, boredom, medication side effects, or someone in the immediate area. Environmental factors are noise, clutter, crowds, sugar, junk food, or caffeine, and loss of independence. Behavior triggers caused by dementia: confusion, frustration, withdrawal, restlessness, poor judgment, emotional instability, loss of mobility. What can I do? Document symptoms, frequency, and severity. You can assess the resident for pain, hunger, constipation, boredom, fear, delirium, medication side effects, or environmental distractions. Techniques to deal with behaviors. Reduce intake of dietary stimulants. Reduce noise, clutter, or people. Try soothing music. Take a short walk. Maintain routines. Distract with a snack. Offer tasks such as folding towels, housekeeping, caring for a baby doll. Remain calm. Use distractions. With behaviors. What you should do is back off, reassure, and ask permission. What you should not do, you shouldn't raise your voice, argue, or make sudden movements. You need to avoid triggers such as noise, clutter, or too many distractions. And please monitor personal comfort and needs. Behaviors. Problem solving. Observe and figure out the causes for the behaviors. Behavior is caused by pain and discomfort, a change in a medication, loud agitation noises, change in sleep patterns, anger, frustration, a change in the routine. What can I do to help? Identify the problem. Assess the problem. Create a plan of action. Evaluate the plan. Re-evaluate often. Create a behavior log. Communicate. What is a physical restraint? Physical restraint is defined as any mechanical or physical material, device, or equipment that is attached to or adjacent to a resident's body. This item restricts the resident's freedom of movement and normal access to his or her own body. It cannot be easily removed by the resident. Managing challenging behaviors without restraints. Offer fluids and snacks frequently. Monitor medications and reactions. Exercise daily. Toilet frequently. Keep the residents entertained and occupied. Alternatives to restraints. Door alarms. Private rooms. Close doors. Lower beds to the floor. Restraints as abuse. Federal and state regulations require other methods to be used other than restraints to control the behavior. Level 2 post-test. True or false? Wandering is not common for dementia residents. That is false. Wandering is extremely common and can happen at any time, so you need to be alert and aware and always assessing your residents. Bathing can sometimes be a battle. Unfortunately, that is true. Create a nice routine, a soothing environment, and find out what your residents' likes and dislikes are and make it as comfortable as possible. Do everything for the Alzheimer's resident. False. Do not do everything for them. Let them assist you. Let them be independent. Dehydration can trigger unwanted behaviors. True. Always monitor liquid intake and watch for signs of dehydration.